I've known Garrett for going on 30 years. The end of this year will be 30 years. With his athletic background and with us being busy, and then as of late for him working out a lot, it was, kind of an assumption that things were good. So when things happened on Father's Day, it was kind of a surprise, a big surprise.
I normally take this 3-mile run, within 30 minutes and with no stopping or no discomfort of any sort. But this time when I went out, I actually had to stop 4 times, had some shortness of breath.
And when he came home, I kind of saw this look on his face. He said he couldn't explain what was going on, just a tightness in his chest, a little tightness in the left side of his shoulder, and it kind of made me really concerned.
I consulted with my wife. I'm not laughing, but she knows that, I rarely complain about any type of illnesses or injuries or whatnot, and kind of work my way through it.
I know he was scared, and I was scared too. I told him we needed to call a doctor, and I called Dr. Itagaki.
So he called and he had a treadmill scheduled. And the treadmill was done at Straub Hospital in the cardiology department.
And then I was scheduled to go back into my primary care physician, Dr. Otaka.
Dr. Otaka, with the help of technology, in that first meeting, he said, let's take a look and see what the test results showed.
I was able to draw right in front of them his result in a matter of seconds.
And in that moment, he got up and he said, you know what, I'm going to get Dr. Itagaki on the phone right now, and we're gonna talk.
When we do an entry into the computer system, he has access to it immediately.
I'm so grateful that Dr. Otaka could get the results and that Dr. Itagaki could get on the phone and they could make a decision on what we were going to do. And in a matter of a couple days, there we were. We took care of him.
I was called to come into Straub early morning of July 5th. And at that point, very nervous, very worried about what was going to transpire.
And he had a coronary angiography procedure. The catheterization was done, and it revealed that he had a well-preserved heart pump, but his right coronary artery, the one that goes behind the heart, was very seriously blocked.
I came in with my bag of magazines and my cell phone and my laptop to do some work, and in a matter of 45 minutes to an hour, Dr. Itagaki came out.
Garrett's procedure went successfully with 2 large stents in tandem into the right coronary.
We got it in time. He had a 98% block of his right coronary artery, and he was able to put 2 stents in, and Garrett's going to be okay.
I mean, it was kind of surreal, knowing that I just gone through this, and a lot more serious things could have happened.
It didn't hit me till I went home early that morning. I told him I was going to be back to feed him breakfast, and I had a moment in the car. I think that's when everything really hit me, because I thought how things could have been so different if he didn't make it. And I took a moment to compose myself and went in the house, and I was just so grateful. And when the boys came to the door, obviously they knew that I wasn't home that night, and I told them that Daddy was going to be okay. And I was just so grateful to Straub and to Dr. Itagaki and Dr. Otaka for their care, and that everything was going to be okay. In fact, that afternoon I went back to the hospital and they discharged him, and we went to watch Dylan's All-Star game.
Garrett is doing very, very well now. He's taken the message to heart. His wife has bought into it. His children have bought into it. And he exercises regularly, almost on a daily basis. And he's lost almost 50 pounds since his procedure in the last 6 months.
Having gone through this as a child, and I say that because when I remember my father, going in for his open heart surgery, I remember specifically how I was feeling the emotion of, possibly losing somebody who you love so much. And reflecting back on it, with my sons and just knowing that, you want to be there for them. You want a second chance at life. You want to make this right by taking care of your health. You want to go there. You want to watch their games when they're growing up. You want to watch your grandkids' games.
I'm just so glad that Garrett got the care he needed so that he could be a husband to me and a father to our children, and that we can have many more years together.